we know Jesus never leaves us nor forsakes us. We know he's always with us, right? It's Christ in us. But seeing him in the clinic, for me, it can change the way I view my patients even.
Hello and welcome to Restore Healthcare Project. I am Dr. Jennifer Kang. I'm so happy to have you here with me again today. And I just want to remind you to like, follow, subscribe, and give us that 5-star review. It really helps us to continue to spread our message and to meet more of you who are heroes with us in healthcare. I am here today with a very special guest, Joey Park, who is a good friend of mine and shares a lot of the same hope for healthcare that I do. So Joey, I'm really happy to have you here. Joey is a physical therapist who trained at Northern Illinois University. He lives now in San Diego with his wife and his 2 kids, really passionate about Jesus. Thank you for being with me today, Joey.
Thanks for having me, Dr. Jen. I'm excited to be here and excited to see what Holy Spirit does with our interview here.
Yes, this is going to be fun because I know you and I know what you love about your specialty. And I wonder if you would just kind of introduce us as a physical therapist, what you do, what the goals of physical therapy are, and give us a little sense of your day-to-day.
Yeah. So as a physical therapist, we evaluate and treat folks with any type of injuries, disabilities, anything that might impair their function. And we develop a treatment plan that will include therapeutic exercise, manual therapy, um, any modalities that will help to restore mobility, reduce pain, restore function, and improve quality of life.
So really, that's healing, isn't it? That's like the definition of healing, to restore all these aspects to relieve suffering. And you get to do this all day long, every day.
Yes, it's a great joy, and I love to see people go back into their normal everyday passions and get back to what they love.
Was there a moment as you did your training or perhaps as you started practicing that you really began to feel connected with that your job was also part of your purpose and calling, and that it wasn't just a job or a vocation?
Yeah, that's been a journey, Dr. Jen. I'd been a PT for 16 years, but a believer for 14. And so I didn't really necessarily know that God was calling me at first. Um, and when I became a believer, what I saw was when you're doing the Lord's work, you're a pastor or you're a missionary. And so I didn't see how my work as a physical therapist could be what God is calling me to do. And so I remember working as a PT and I really wanted to do the Lord's work. And I remember going during my lunches and evangelizing. I would go to the plaza next door and tell people about Jesus because I felt like, at least for those 30 minutes, I was doing what God's calling me to do. And then I go back to my job as a physical therapist, just helping people and doing my normal non missionary work.
So you really separated that at first. You felt like you had to take a break from your job in order to live out this newfound faith that you had.
Absolutely. Absolutely. And when the Lord, when I encountered the Holy Spirit and I saw that, wow, God does heal, I began to try to translate that to my work in PT. And so I would begin to ask my patients if they wanted prayer. And it was amazing. God would supernaturally heal them. And I was seeing more healings than my normal practice in PT. And I was so passionate about it. And I found myself so vitalized by seeing that I looked at that as God moving. And I looked at people getting better with my skills in PT as, yeah, that's because maybe prayer didn't work, or that's maybe a lesser than
Yep.
healing,
So
right?
did you first encounter you're referencing supernatural healing. Did you first encounter that
Mhm.
outside of your practice and
Yeah.
how did that begin to stir in you and you decided you wanted to see it inside of your practice? Was that a process or was that fast?
That well, was, I would say it's pretty fast. I mean, I experienced it. There was a healing evangelist, Randy Clark. Of course, you know him. He came to our church, and I had no idea that God still healed. And I was sitting through these services and seeing the very conditions that I treat and treat for months sometimes. I was seeing these conditions healed in moments. And I thought to myself, I'm like, Lord, if you could do that in church, well, certainly you can do that in my clinic. And so then I thought, well, maybe if I try to do what I saw in the church, that it might happen in my clinic.
Yeah. I mean, how amazing is that? As a clinician, I think that sometimes that gives us this very unique perspective. And we're sitting perhaps in a very spiritual, religious setting and interacting with people who are encountering a living God who has the desire and ability to heal them. And we as clinicians can verify that their condition has changed. And we have this unique perspective, I think, that others maybe don't have. I'm so grateful for it. Would you feel that way too? You're seeing people talking about their shoulder mobility being restored, and you're observing as a physical therapist. In fact, yes, that is happening.
Absolutely. Yeah. In fact, I believe Randy Clark needed to go through physical therapy, and I believe some of the things where he checks range of motion before and after was inspired by that. And so, yeah, it's awesome to be able to see a pre, right? We always do a pre examination, and then we do a treatment, and then we'll see how the effects of that treatment by doing a recheck afterwards. And so to be able to do that with prayer was really cool to be able to do as a physical therapist, using my skill sets to be able to examine and to be able to see people's limitations, and then incorporate that with prayer, and see the effects of prayer immediately in my clinic.
Wow. Well, talk to me a little bit about how you experienced this initial interaction with patients when you offered to pray with them, when you offered to connect them with your spiritual practice.
Yeah, so I am by nature a more introverted person, and so I wouldn't say I'm that bold um, evangelist that right away I wanted to do it. So the first time I ever saw supernatural healing, I had a patient that had a significant leg length discrepancy. It was about, I think it was about 2 inches. He actually wore the specific type of shoe and needed to correct that alignment. And so I remember seeing in these meetings legs growing. And so I thought, I wonder if this is possible. And so while I was working with him, I was doing some gait training. I was doing gait training in the parallel bars. And I remember just praying silently to myself. I said, Lord, would you grow his leg out? And I remember when we got back to the treatment table, just doing our exercises. So it didn't have to be obvious, but I had him, I measured his leg length and saw that his leg length actually evened out. And I could not believe it. I double checked, I triple checked, I kept checking. I'm like, this can't be real. I had his daughter come and check for herself, and she began to be shocked at what happened. And so I was like, wow, God, you can do this outside of the church.
Oh, wow. And in that case, Joey, you just talked to God silently. Hmm. Tell me a little bit more about how you got bolder. Sometimes you do that. Sometimes you don't feel like prayer is actually overtly necessary. That's been a process for you, hasn't it, to discover that with the Lord?
When I first started doing it, as healthcare providers, we can ask that is spirituality important to you? Is faith important to you? And so I learned that from Dr. Levy, who spoke at the Bethel Medical Conference 2015, I believe. And he mentioned that a lot of people are actually wanting to incorporate their faith, wanting to incorporate their spirituality with their well-being, with their health. And so I began to ask the question in a way where it wasn't at all imposing, at all pressuring, because as providers, we don't want to ever, our patients ever feel that pressure. So um, just walking with Holy Spirit and gauging the patient's openness, I would ask if the prayer is something they would like. And so as I did that, I found that a lot of patients were wanting prayer. In fact, I can think of maybe less than the fingers on my hand of people that ever declined prayer. And so I saw the openness, the hunger for God to be a part of people's healing journey.
Yeah, yeah. And you, in particular, have developed a heart for patients in pain. It seems kind of natural for a physical therapist. You encounter people in pain quite frequently, don't you? But you've developed a heart for that, and maybe you could tell me a little bit about that and your experience with that, and how you view it. Is it something God did for you?
Yeah, I did not go into PT wanting to treat chronic pain. And in fact, if you ask many healthcare providers, when I say I'm passionate about treating chronic pain, you get a sort of look as if I'm crazy, because it can be multidimensional, and it can be a very complicated thing, and sometimes difficult to see immediate improvements. But I started to work. I was working in a sports medicine clinic, and I would see patients get better, be ready, meet their goals, they were ready for discharge, and then they would come back again the next year. And I began to see this cycle of people continuing to come back. And it wasn't though they were being injured again or they did anything for it to reoccur. It was just the pain was coming back. And so I began to dive a little deeper into the neuroscience of pain and learn about the biopsychosocial approach, which the medical world uses as the most up-to-date science on pain. But as believers, as someone that has been learning about healing in the church, learning about inner healing, learning about freedom and deliverance, as believers, I believe we have the biopsychosocial spiritual approach. And so I felt passionate about chronic pain because I believe as believers, we are equipped to address the whole person, body, soul, and spirit. And I feel, I just felt like the
So
Holy Spirit.
critical to emphasize that you're actually discovering, along with the Holy Spirit, that there's another dimension that you carry that's needed. I think you're right when you say a lot of clinicians feel trepidation when caring for chronic pain people. Why do you think that is? And what is it that has shifted in your heart that's given you a love for them?
I think the way the healthcare system is set up, I think it puts us at a disadvantage because we feel a lot of pressure to get immediate results.
Mm-hmm.
We're not giving a whole lot of time to treat someone in chronic pain. And I think when we're looking at the whole person, we need a whole team. And so it takes more than one individual, but we need a multidisciplinary approach to treat a multidimensional condition.
Mm-hmm.
And so I think there's a lot of pressure if we're trying to do this on our own.
Mm-hmm.
And so I think there's that pressure and burden that often pushes us as providers away from feeling confident in treating a person holistically.
Hey, Healthcare Tribe, I hope that you have been impacted by what I've brought through this podcast. I also want you to know about opportunities to give back through my nonprofit, Selah Health International. We work to support projects for women and children of vulnerable populations around the world. You can learn more and donate on our website, selahealthinternational.org. Yeah. But you have developed a confidence in it. Tell me a little bit about that. And were there any particular patient encounters that you would say marked you in that?
Sometimes I think it's easy to overlook some of the roots to the problems that our patients will often tell us. I think it's easy to maybe dismiss some of the story when patients are explaining what's going on. But I found that as we listen to their story, they will often give us the root to the problem, whether or not it is an obvious thing or not. And so what I mean by that is, I think if we have the medical lens, if I'm looking at a person as a PT, I'm looking for mechanical things, right? I'm looking for, did you fall? Were you in a car accident, right? But then the patients will begin to share these stories of emotional wounds, of traumas that happened around the time that their pain started. And so the Lord began to show me that that's why they're in pain. And if we address that piece, we can get freedom and healing from their pain.
Mm. So you actually have been experiencing a relational component with the Holy Spirit that's led you to focus on all aspects of a patient's being to help treat them. And this is you as a physical therapist saying this. This is amazing. You certainly have seen significant healing and relief given to patients through the physical therapy, the actual physical treatment that you're giving them. That's been beautiful. Have you ever seen that be beyond what you expected it to be?
Yeah, as far as the natural means, right? Um, Funny story, in 2017 at the Bethel Medical Conference, I had a prophetic word, and she gave me a very specific word about fascia. And she said, I saw you working with the fascia and using your fingertips around the cranium, and you won't even know what you're doing at first, but you're going to see amazing recovery. And I remember that that time, the clinic I was at happened to be doing a technique called fascial counterstrain. And so it's a technique that works to slacken the fascia, alleviate inflammation, and the recoveries are usually pretty immediate and pretty significant. And I can remember the first time I started doing this technique, I had a patient who had CRPS. CRPS is chronic regional pain syndrome. It's where one of the limbs are very sensitive. There's discoloration. Oftentimes, it's really painful to even touch the limb. And so, it was a young teenage patient, and she had CRPS in the right leg. And I remember doing this technique for 30 minutes. I was alleviating that fascia. And I remember immediately as she stood up, she didn't have any pain in her leg. And it was just like what I see in a meeting, a healing meeting at church. She was, what did you do? I can touch my leg. I can move my leg. What did you do? And it was this immediate recovery with my natural skill sets that God put in our bodies to be able to recover. God created this design for our bodies to heal. It wasn't through laying on of hands or praying, but it was miraculous. And I can tell you, her being able to return back to softball and run and jump on this leg, this is something that the doctors had been, they did not give her a lot of hope for it. It's something where they said, softball might not be something you're going to be able to get back to. This is a pretty serious condition. We're just going to try to do pain management. And that's what our program is. The goal is managing pain, but she got to see more than that.
Immediate. Yeah, you certainly are used to the kind of the perseverance of ongoing, persistent therapy resulting in gradual return of function or relief of pain. But you're talking about having been exposed to and given the opportunity to learn a new technique that actually felt supernatural in that it resulted in complete relief immediately. I mean, I just think this is so fantastic. It wasn't supernatural, and yet the the ability that you had to access that and to give it away was predicted by a prophetic word. You were able to experience it and give it away in a way that was actually Holy Spirit filled. Um, I think it's important to acknowledge that, don't you? That actually what we are able to do, even what we call natural, is a gift from God.
Absolutely. I think if we honor what God's given, Jesus healed in different ways, and I believe there's different ways that the Lord's created us to recover from, and different ways of healing, and it's to the glory of God. And I just think supernatural or natural, walking with the Holy Spirit, talking with Him as we're treating patients, is so important, and it's so gratifying to be able to connect with the Lord in that way, and to give Him glory, and really recognize that He is the one doing it. And it's not my own ability and not my own skills, but it's God given, and it's to His glory. Absolutely.
Wow. I'm sure that patient felt like it was supernatural for her. Certainly, you have also seen people recover in ways that you can't explain, and it doesn't seem to be related to what you do. And we might term that supernatural healing. What has been your experience in that? How has God surprised you?
I love seeing God move in that way. I love, like I said, the natural is beautiful, and the supernatural is equally as beautiful. And I can remember I had a patient who had both shoulders, both knees, severe arthritis, and so quite a bit of pain, very limited in her mobility. And I remember, again, I asked her if she'd be open to receiving prayer, and she was Catholic, and she was very open to it. And I remember saying a quick little prayer, because oftentimes I only have 30 seconds to a minute to really release prayer between patients. And she was very thankful for it. And I didn't hear from her for about 4 weeks. And so she came back for an appointment, and I asked her, I was interested. How are you doing? I haven't seen you in 4 weeks. And she goes, I haven't had shoulder or knee pain since then. Completely restored, mobility completely restored. And in fact, her daughter came with her that appointment, and then she in turn asked for prayer as well. And so there was this holy moment of being able to pray for both of them in that moment, and they both received actually a baptism in the Holy Spirit. And we were in the little
In
private
your
treatment room.
physical
And I
therapy
remember
treatment room?
I remember just sitting there, and I was documenting as the Holy Spirit is just touching them, because I didn't know what else to be doing. I knew, Holy Spirit, this is amazing. I have 5 minutes until my next patient. I don't know how I'm going to get to this next patient, because they were experiencing the presence of God in a powerful way. I didn't want to interrupt it. So it was a little nerve-wracking, but it was just a powerful, powerful moment where my patient was touched, but then also her family was touched. And so to be able to see this God just move in families as well was really powerful. It's something that I won't forget.
Wow. And that is the evidence of the Holy Spirit's work. It's just the ripple effect of restoration. Yeah. You alluded a little bit to being on a discovery of the root causes of patients' pain, and sometimes realizing it's not just a physical or mechanical source. It has multi dimensions, including emotional sources and even spiritual sources. Um, was that something you learned by patient? Was it something the Holy Spirit began to point out to you? Can you take us a little bit on that journey of how you began to discover and want to be a part of this multidimensional healing with your patients?
I think there was a parallel of me learning about healing supernaturally in church, and really this idea that God heals the brokenhearted. He sets the captives free, right? So I was learning this in church, and I was seeing the connection of emotions, wounds with my patients. I think the one that highlighted a lot was this idea of a lot of patients I was working with had a lot of burdens. They were carrying a lot of weight, a lot of stress, and a lot of oftentimes unforgiveness. And it became a very natural discussion with my patients about the weight that they're carrying in life and the heaviness they feel in their physical body. And so as I would have opportunities to talk to people about unforgiveness, about handing their burdens to Jesus, they began to see that manifestation of weight being lifted off spiritually, emotionally, but then they would see the manifestation physically by feeling less weight in their shoulders, less weight in their back, in their knees. And they began to see more breakthrough in healing as we did that. And so I began to see this as a constant pattern early on, and I knew this is key. This is more than degenerative arthritis. This is more than rotator cuff tendonitis. This is sometimes emotional, sometimes spiritual, but not always.
Yeah. So really, there isn't a protocol you can follow. You actually have to have a relationship with Holy Spirit to guide you through that. And isn't that so amazing that you can actually ask him, what is it here? And what do we go after? Um, but it's possible. And I think sometimes some of us as busy clinicians, we worry that if it's multidimensional, how are we going to add yet another thing to our work schedule that we have to do for patients? And for you, it's like a privilege and a door you walk through. And you've been able to discover that you can do it without getting behind in your schedule, and that you can connect with patients on an emotional and spiritual level that actually changes things. Um, has it been hard for you to figure out how to work that in?
Absolutely. Absolutely. You know, as healthcare providers, we want to be able to equip and give all the information to our patients. We want to cover everything because we want to be thorough. We want to do a good job of making sure that we cover all bases, right? But what I've learned is that I need to trust the Holy Spirit. And if He's speaking to me about maybe one specific instance that I need to focus on in that moment, I've learned to sort of trust that maybe that's the only thing we're going to cover, but maybe that's the only thing that needs to be done in this moment.
Yeah. So it's the Holy Spirit who actually helps you be efficient in your time too.
Absolutely. He's good about that, huh?
He is, and he brings comfort and peace all within the constructs of where we're serving. I just love how you've begun to give us a little taste of this, and I know that there's a lot more that you can share with us. But I'm just amazed by the edges of what you're beginning to describe for us is possible as a clinician walking with the Holy Spirit. I do have one last question for you, and I ask this of all my guests. We've been astounded by some of the answers we've gotten. In your heart, when you think about where would you find Jesus in a healthcare setting, let's say a hospital or your physical therapy office, where do you think that you would find him, or where do you know that you find him?
I love that question. I love that question. We know Jesus never leaves us nor forsakes us. We know he's always with us, right? It's Christ in us. But seeing him in the clinic, for me, it can change the way I view my patients even. So I haven't, I'll give an example. I had a patient who sometimes sometimes we can discern the atmosphere, right? And so as soon as I walked into that room, I immediately felt anger. I started clenching my fists. I can sense the amount of anger that the patient had been carrying, that maybe they've been going through, that maybe they've been hurt. And I couldn't really get through this anger until I asked the Lord, Holy Spirit, what is going on right now? And I'll never forget, I saw this picture right away. My patient was sitting there, and I can see Jesus to his right shoulder. And Jesus was wiping away his tears. And so the Lord began to show me the amount of hurt and pain that this patient was going through. And it shifted the way I saw this patient. Because I can tell you, normally I would probably be put off by this patient and probably just want to get through that session as quick as possible so I don't have to deal with it, right? But seeing Jesus working and seeing what he's doing in that clinic shifted how I saw this patient.
Mm. It changes everything, doesn't it? To see what he's doing. And it does. It draws you in to want to do it with him. And it changes your response to those patients. Wow, Jesus is present in your treatment room, and he has a box of Kleenex, and he is wiping tears. What a beautiful picture. Jesus, the great tear wiper. Thank you, Joey. This has been absolutely fantastic to talk with you and to hear about your experience with healthcare and Jesus. We hope to have you again and hear more from you.
Thanks for having me, Dr. Jen. It was so great to be here. I have to tell you, you are one of my Kingdom healthcare heroes. And so it is an honor to be having this talk with you today.
Awesome. And thank you to all of you who've joined us today for this incredible discussion with Joey Park, physical therapist extraordinaire and lover of the Holy Spirit. This has been the Restore Healthcare Project. I'm Dr. Jennifer Kang. Healthcare professionals, I'm so excited to be able to connect with you on issues regarding spiritual needs in healthcare. We want to partner together to see some of the ruined places of healthcare culture restored by hope. Follow us at restorehealthcareproject.org and like and subscribe to our YouTube channel and social media.